Hi, my name is Chris. I'm with the BC Lung Association, and I'm very pleased to be sitting here with Dr. Corwin Zigler, who's the Assistant Professor of Biostatistics at Harvard. Welcome.
Thank you very much.
So let's get right into it. Why is it so difficult to attribute health improvements to specific air quality policies or interventions?
It's a good question, and there are a lot of reasons, but I'll name a few. One is that on the slide here is this nice summary graphic put together by the Health Effects Institute. I didn't come up with this, but it depicts the kind of cascading events that happen after a policy is initiated. So we start with a policy up here in the upper left-hand corner of the slide, and as we think about drawing a connection between that policy and health, we have to think about what happens to pollution emissions, what happens to then the reactions in the atmosphere that cause the air pollution that we breathe, what people's behavioral patterns lead to them to be exposed to higher or lower levels of the pollution in the air, and then that ultimately will dictate their human health response. So drawing this line from a person's health response to an actual policy can be very, very complicated, and it sort of gets, as you move down this cascading chain of events, it gets more and more difficult to attribute any signal to any specific policy.
Right. So what methods have you come up with or are out there that we can sort of use to help evaluate that sort of impact?
There are, I like to think of the methods as being in two classes. So personally, I'm engaged in the development of statistical methods. Take measurements on air pollution, on people when they're showing up to the hospital, where they live, on policies, whether certain areas of a country implement certain policies or not, and then try to measure with statistical methods the impacts of those policies and attribute any signals in data, improvements in health to those policies. So that's one class of methods, again, growing more out of the statistics, epidemiology, econometrics literature. There are other methods that are used in this that are more from the atmospheric science literature, atmospheric engineering, chemical engineering, that use very sophisticated models to predict what air pollution might be under different regulatory or different policy scenarios. So I think those are the two groups of methods, and I think there's some convergence in terms of the tools from those different fields, which is good.
So I mean, obviously we talked a lot about statistics. So where do you get this information, and how do you use that information really to implement some of these methods? Yeah,
I mean, it can depend a lot on the type of policy we're interested in, but I think for big regional policies, government programs, things like that, there is the data sources are getting richer and richer. The technology to measure things like pollution and emissions are improving. People measuring remote sensing technology to measure air pollution, even to measure emissions. And then increasingly people are turning to administrative health records, insurance billing claims data, so that health outcomes are available on millions and millions of people who all breathe the air that's outside.
Absolutely. So here's the $1,000,000 question. Okay. So if health benefits of any one policy or intervention that we've discussed can't really be demonstrated, does that mean it wasn't really worth implementing altogether?
I don't think so. I think that it's important, even though I specialize and other people specialize in quantifying effects of specific policies, I think it's important to interpret these things in the broader scientific context. There's a lot of science understanding from all kinds of fields that probably motivated that policy in the first place. And so I don't think that should be forgotten. And the other thing, if every analysis makes everybody convinced that some policy really didn't work, I mean, I think I'll direct attention back to these slides. Something that also appears in this chain of accountability is these sort of feedback loops, these arrows that point from the human health response back into the regulation, because even if it were concluded that a policy weren't effective, there should be some understanding of why it was expected to work, it didn't, and then that can feed back into the system so that the next time a regulation or policy is set, that information can be used to refine things that are in place.
Perfect. I just want to point out to our viewers that Corey's slides will be available on our website, so you can take a look at that afterwards. That's sort of all the time we have right now, so I want to take this moment to thank Dr. Zigler for taking this time right now. Thank you.
Thanks very much. Pleasure to be here.